Hi everyone, welcome back again to today's lecture, and today we're going to be talking about drug administration, and we'll be considering all the routes of drug administration. Please stay tuned till the end. I remember while I was in nursing school, one of the common questions I usually ask myself is, I found that in hospital settings that doctors prescribe drug, pharmacies also help to analyze drug prescriptions and dispense drug prescriptions, and nurses at the end of the day just administer drug. I kind of started to question myself and to ask myself, why do we actually have to go through the rigorous process of pharmacology if that's all I'm going to be able to do, or if that's all my duties is restricted to in the hospital? So because of this question, I pondered on as a nursing student, which I finally had my answer before graduation. I thought that we could begin this subject by talking about that. Why do a nursing student need to know about drug administration? Well, first of all, I think the major reason is to limit the severity, or even to totally limit the number of adverse events that happen in hospitals, and also, even if it happens, to be able to curtail the severity of this adverse event to a patient. Now, what are adverse events? Now, when we talk about drugs, we already spoke about the absorption and of drugs into systemic circulation. Now, I needed to know that there are some effects that are likely expected when a drug is taken that is not the exact effect that was wanted during the time of administration. Now, there is a difference between drug effect, side effect, and adverse event. What is a drug effect? It is the expected effect that is supposed to bring about a possible outcome in an area of disease of a patient. Now, just see it this way. I am having malaria, or I am diagnosed with malaria, and I take a malaria medication. What is my expected effect? I expect that the symptoms of malaria is either diminished or reduced with the passing time. What that means is that I expect fever to be gone. I expect the bitter taste of the mouth, or the bitter taste of the tongue for someone that it has malaria. I expect the body pains to be reduced, but there are some things I don't expect. I don't expect to be excessively drowsy. As part of the reasons why I took this drug, I do not expect to be weak. I do not expect to have rigor. I do not expect all these things. But part of these things happen while a drug is taken. Now, the expected effect, that is the outcome we are expecting, the possible or the positive outcome that we are expecting as of when we took that drug, is this drug effect. Now, there are some effects that was not the initial reason why we took the drug. But if I take a malaria medication, it is expected that after absorption through my intestines, it will get to the liver, from there portal circulation, from the portal circulation through the hepatic artery to my systemic circulation to my heart, and then distributed around my body. I cannot restrict the flow of blood and say, okay, I just need this in one area. Or let me use something we can mostly relate to: a pain medication. So I take a pain medication, either a Panadol medication, and I'm having pains in my upper limbs. Now, while the drug is distributing, I cannot restrict the blood and say, okay, I need all the drug or the blood that contains this drug to only move to my upper limb. No, they would distribute around the body. Then the areas affected would lead to positive outcomes, which is the drug effect. Now, how about the areas not affected? They will have some effect of the possible concentration of active ingredients in the blood, and that's the side effect. Now, among the effects that we are not expecting, among the effect that is not the reason why we took this drug, there is the expected side effect, and there is the unexpected adverse event. So side effect is more like, we already know that if I to take a malaria medication, I'm more likely to experience sweating. I'm more likely to experience signs that these are side effects that are also showing off as signs that a drug is working or a drug is effective. But there's some effects I'm not expecting. I take a tetracycline medication. I'm not expecting that if I give that to my child, it should have browning or yellowing of the teeth. There are things you don't expect. Consider the thalidomide disaster that happened then with pregnant women. I'm very sure that that was not part of the plan. Neither was it part of the side effect during the time that that drug was manufactured. But the thalidomide disaster happened and it affected a lot of pregnant women and made a lot of infants to be deformed. So these are adverse events. They are like unexpected outcomes that are negative outcomes, unexpected negative outcomes that I am not expecting. So having considered that this is the positive, now this both will give us the negative. Now under this negative, the side effect is expected and the adverse event is unexpected. A nurse is supposed to have a lot of pharmacological knowledge to be able to help to reduce the risk of adverse events, the severity, or even limit the number of adverse events. A lot of adverse events happen as a result of medication errors, as a result of lack of full knowledge of the disease condition of the patient or the pharmacology concentration of the patient. As much as doctors prescribe this drug, they are humans and anyone is liable to make a mistake. So a nurse is there to stand in for the safety of the patient because of her knowledge or his knowledge of the pharmacological interpretations or pharmacological classifications. He can be able to tell when a drug category is at risk for a patient. Now, a nurse is expected to know the drug name, a drug classification, the use of the drug, so that when a nurse knows the use of a drug and a wrong prescription is done, it is easy for a nurse to correct that or to call to attention whosoever prescribed this drug that this would cause this for a patient. And it's important for a nurse to know the effects of this drug, the contraindications, who is contraindicated to taking this drug. There are several contraindications in drug terming. There is a contraindication A, contraindication B, contraindication C, D, and E. And E, which happens to be the worst, leads to fatal risk. Now, she's also supposed to know what is the expected side effect. Now, if I know the expected side effect, then I'm able to know when an adverse event occur, because an adverse event is just simply an unexpected effect, an unexpected negative effect. So if I'm able to find out that on time, I'll be able to reduce the possibility or to reduce the severity of the negative outcome. Having said all of that, while prescribing medications, a nurse, according to the Institute of Safe Medical Practice, is supposed to follow the 5 rights and 3 checks of drug administration. What are the 5 rights? I'm quite certain that you're very common with some rights of drug administration. And the reason why this is commonly followed and even have others added to this right, they are no longer 5 rights, but according to standard, we continue to stick with at least these 5 rights of this administration. When you are about to administer a drug, the first thing you are to do is to confirm if that is the right patient. Okay, I'm going to follow this in no particular order, but you have to be sure that that's the right patient. How are you going to be sure that that's the right patient? There are several means of identification. One of them includes asking the patient to tell you his or her full name. Now, you are going to cross-check the full name with the name on the medication administration record. You want to be sure that that's the right medication. You also want to be sure that that is the drug you are administering is in the right dosage. We talked about dosage in our last video, where we discussed the difference between dosage form and the difference between dose and the difference between dose size. Now, you also want to be sure that that is the right time. Now, why is this important? For example, some drugs have a lot of sedating effects. So it's likely to make a patient to sleep off while taking this drug. You want to be sure that that's the right time. You can't be administering a drug that has sedative effects in the morning, especially for a mobile patient that would travel, that would drive, that would lead to road accidents or increased cases of road traffic accidents. Still the same thing. Now, you want to be sure that that's the right route of administration. You don't want to take a drug that should be administered intramuscularly directly into the vein. You don't want to take a drug that should be administered rectally and should be given orally. You don't want to make these mistakes because these drugs have been modified to suit their route of administration. So the nurse is supposed to check or supposed to follow these 5 rights while administering medication. Now, what are the 3 checks? It's important to know that regardless of the fact of whether you are using a machine to administer a drug or not, these 3 checks should be followed to reduce the risk of adverse events. Now, one of the first checks is to confirm the drug while withdrawing it from the medication administration record. Now, I want to give this drug to this patient. I want to administer an IV medication to a patient. I'm supposed to first confirm this drug, or I want to administer an intramuscular medication, maybe a morphine medication. I would first of all confirm it while withdrawing it. Reasons for this: it could be wrong. It could be the wrong drug you're picking out. You could have known the morphine to always be by the right side of the medication administration drawer, and you go there and it's not there, and you pick up something else and administer to a patient. You want to be sure before. Now, while mixing the drug, you also want to confirm. There are some drugs that need to be crushed, some drugs need to be prepared, some drugs need to be mixed, some drugs need to be whatsoever form the drug is taken. You want to confirm while doing it, while mixing the drug, while preparing the medication, while doing all of this. And the last thing you want to confirm is before giving it to the patient. We considered before preparing the drug, while preparing the drug, then finally before administering the drug. You'd confirm for the last time or check for the last time that, okay, this is the right drug, this is the right dosage, I'm supposed to give this is the right route. You check the last time. So a nurse following these 5 rights should obviously also follow these 3 checks, because this will help to reduce. Now, having said that, adverse events cannot totally be curtailed, but at least we could reduce the risk of this drug providing negative outcomes, especially in their extreme natures. So I wrote down some general checkpoints that we are to see before drug administration in no specific order, actually, but we have the acronym here. We'll use to learn this, and that's the VAPID. I want you to think of the word rapid. Think of the word rapid, then just sort of makes sense that you just have it as VAPID. There's some things you want to check. Firstly, you want to verify the medication order, which includes things like this. For example, I'm supposed to administer 500 mg of Tylenol 1 × 2 daily. Now, before administering that drug, I would like to check, okay, 500 mg, not 1 gram, 500 mg, Tylenol, okay, this is Tylenol, okay, 1 × 2 daily, morning and night. You want to be sure of these things before beginning to administer drug. You also want to apply your gloves. If it is in a normal drug administration setting, it's very advisable to prevent the risk of infection as much as possible. Well, that's why you have to apply your gloves. But for a parenteral administration, which is whatsoever drug that involves injections and syringe into the body system without passing per orally or rectally, you want to be more careful. Why? Because there is increased risk of infection, because this is going directly into the bloodstream or have a higher chance of meeting the bloodstream than most other medications. So you want to follow aseptic techniques, which includes washing your hands, sanitizing the environment, making sure you're in sterile gloves, making sure that the environment is sterile, the environment for the drug administration. Now, you want to check your patient for allergies. It's important to know what patient reacts to what form of substance or whatsoever it is. This is important, and the nurse usually gets this information before administration. A nurse is supposed to have the information of the patient. That's by interrogating a patient or to obtain patient history. Through obtaining patient history, you'll be able to know that this patient is allergic to this drug and this patient is not allergic to this drug. And it's important that when you find out an allergy that the patient has, you inform the therapeutic team or the team that is working with that patient that this patient have an allergy to penicillin. So what that means is that during administration, to an extent, penicillin drug can be substituted for another antibiotic of the same effect to avoid worsening the previous state of the patient. Now, you want to be able to position appropriately. Positioning actually depends on the kind of drug you're giving. For rectal drugs, a seam's position is mostly assumed. For for per oral medications, it's important that the patient stays in a sitting position. So the position depends actually on the route of administration. You want to identify the patient. How do you identify the patient? Just like we said before, ask the patient to call out your full name. What is your full name? If the patient is unconscious, if the patient relative, patient friends, patient guardian is around, they should be able to call out the full name of the patient. And another thing to ask for identification, also the date of birth. The reason for this is that two patients can have the same name, and you want to be able to properly differentiate which patient from which patient. Another thing you need to know is inform the patient. You can't just come with some drug like the way I see some nurses do, and it's very unprofessional to just go to a patient and just be like, this is your drug, and just take it. What? A patient is supposed to be educated. What drug is this? What effect would this have on me? What are the possible side effects I should be expecting? What is the pathological condition that this is treating? They are important information that a patient should know. A patient has the right to be educated on the drug that he's taken. Aside that, after even educating, a patient also has the right to say, no, I don't want to take this drug. And every normal adult patient has the right to disagree with some medication. Now, in this particular case, it is important for the nurse, through the nursing process, to make the patient to be an active participant of his drug treatment or active participant of his medication administration, so the patient can be able to decide that I don't want this or I want this. Now, if a patient decides that I don't want this drug, what can a nurse do? Well, in that particular situation, a nurse is supposed to educate the patient more on the drug, ask the patient what are your fears, what are your worries, if possible, explain or expatiate more on whatsoever is burdensome to this patient, to be able to arrive at a point where the patient can make an informed decision on whether they would want to take this drug or not. Because possibly one of the reasons they don't want to take this drug can be because of misconceptions that a patient has had coming from home or whatsoever. And if you should follow just what the patient say, oh, I don't want to take this drug, okay, fine, bye. What about if the reason the patient don't want to take the drug is because of misconception? That is why you educate the patient properly and give the patient the right to make an informed decision. Now, finally, you want to document. I see some young student nurses make some mistake with documentation. Before administering a drug, you already document. Why? You have to wait until the drug is administered before you document, for several reasons. You want to be sure that the drug was finally accepted by the patient. You don't want to be in a haste to do things disorderly. You want to make sure that the drug was firstly administered and that the patient has taken it before you record that it was taken. And if it happened that the patient refused to take the drug, it's also important that you document there. If possible, state the reasons that the patient told you that this is the reason they don't want to take this drug. You state the reason also during documentation. There are three basic categories used to describe the route of drug administration, which I just gave us with the acronym PET. So P stands for parenteral route, then E stands for enteral route, and T stands for the topical route. Either of these routes can be used while administering drugs. I want us to start from the enteral route of drug administration. So enteral is basically drug that is administered directly into the gastrointestinal tract. That does not mean that it has to be direct through a gastronomy tube exactly. It could be per oral, rectally, because at the end of the day, even drugs administered rectally can find its way to the gastrointestinal system. So I mentioned some different examples of enteral drugs that can be administered per enteral route. We have orally, and I explained to us in the last video that orally is different from per orally. Orally is basically drugs that can pass through the mouth, drugs that have everything to do with the mouth. It could be sublingually under the tongue, it could be buccally between the gum and the cheek or whatsoever way. And we talk about nasogastric tube. This is a flexible, thin, flexible, soft tube that is passed from the mouth directly into the stomach. And drugs are administered through each of these ways, or the gastronomy tubes, whereby a tube is connected directly to the stomach. And this is usually used for longer term medications, while nasogastric tube is used for shorter term medications. Finally, rectum. And I also forgot to add per oral drug medication, per oral drug administration. Now, like I already said, a drug can be buccal or sublingual. A drug can be administered buccally or sublingually. Now, what is the difference and why would I want to choose this? Sublingually, just think of it under the tongue. Think of the word for tongue, ling, under the tongue. So these drugs are usually small, very small. They're made in such a way that they're easily degraded. By easily degraded, I mean rapidly absorbed. So your person does not have to swallow, it doesn't have to chew, you don't have to move your tongue. Just while it is under, it begins its absorption. While sublingually, same thing, but this time around, it's placed between the gum and the cheek and left in the same position until after the drug has been administered, after which the patient can flush it down with a cup of water. One of the major differences buccal and sublingual is that buccal tend to have more permeability. Well, even while having more permeability, sublingual absorbs drug more rapidly. So sublingual is usually chosen for drug that wants to be absorbed more rapidly, while buccal drug administration is usually chosen because of it has greater mucosal area, so it can give off or allow for sustained release medication. So generally, oral drug is absorbed in the mouth cavity. It's that simple. So we're going to talk briefly on the advantage and disadvantage of taking drugs orally. Firstly, oral drugs do not have to undergo first pass mechanism. Why? Because they're directly absorbed. They are directly absorbed. They don't get to pass through the liver and all of those. So they're directly absorbed because of the rapid absorption technique that was considered while manufacturing just drug. So they are rapidly absorbed into the bloodstream. Secondly, they escape destruction by the GIT enzyme. We already know that a lot of enzymes are found in the stomach that helps to destroy drugs even before getting to the liver. So it helps to avoid such mechanisms. And lastly, our rapid absorption. But it has some disadvantages. It could be inconvenient for a patient to just sit still or to lie still and have some drug beneath the tongue or have some drug between the gum and the cheeks for a while waiting for it to absorb. In as much as these drugs absorb fast, some patients might not really find it pleasant, so it's quite inconvenient. Secondly, some drugs have unpleasant taste, though a lot of pharmaceutics now produce these drugs having in consideration that patients might not like the unpleasant taste, and now there are a lot of flavors that can now be attached to this kind of drug medications. Now let's move into per oral drug administration. So like I said, and I've always been saying, per oral just simply means that the drug was swallowed. And not just orally, where it was put under the tongue, by the cheek, it was swallowed. Now, different methods can be used to give this drug. For some patients, you can crush the drug. For some patients, for younger children, can spray on their food. But you have to be careful with that as a nurse doing that, because there are some drugs that do not allow you to do these things, that would not want you to do this thing. For example, enteric coated tablets were enterically coated for some reason. They were enteric coated for a good reason. So you should always check with the pharmaceutical instruction as to whether this drug can be crushed or not. So having said all of that, since it's swallowed, we already know that it goes through first pass. So what that means is that the drug is chemically reduced. The concentration of the drug is reduced, but not chemically degraded, just reduced in drug concentration, and maybe the change, the shape or the structure of the drug is already chemically altered. Advantages of this, one of the advantages of this per oral method is emetic administration, just simply inducing vomiting. For example, in some opioid containing derivative, you can just administer naloxone to induce vomiting in case of overdosage or whatsoever. So emetic administration can be used to induce vomiting in case there is any error that was notified or that was found out in a short while. Another thing is that it has various dosage form. We talked about dosage form in the last video where we say a drug can be in tablet form, capsule form, whatever form. So these various dosage form helps to or better suits to a person's choice. A person can prefer capsule over just tablets or whatsoever way. So because of the difference of verified dosage form that we have, it's very easier to make use of per oral medications. It's less invasive. It's not like parenteral administrations where we would have to use needle, syringe and all of those things. So the risk for infection is even lower. So it's less invasive method of drug administration. Is easily administered. Anybody can just easily swallow a drug. But a patient that has an IV medication to take would be expecting a nurse to come and administer it. Lastly, it's very convenient. It can even be taken while standing, sitting, though the recommended position for per oral administration is a sitting position. Now, it also has its disadvantages, which we already know that first pass effect is already a disadvantage. So we cannot expect this drug to give us exactly what we took in. So I expected something lesser or an effect lesser than the concentration that we initially ingested. Secondly, irritation to the gastric mucosa, especially enteric coated tablets that were crushed to dissolve. They were mostly even enteric coated because of the irritation that usually causes the gastric mucosa lining of either the stomach or the intestine or the intestine wall. It is too slow for emergencies. It's not possible because it cannot be used for emergencies. Because come to think of it, before the lag time of the pharmacokinetic lag time and even the pharmacodynamic lag time, it's going to be a lot before the drug is finally be able to active ingredients of the drug is finally able to bind to the receptors that would be waiting to receive this drug and initiate a conformational change. It has an unpleasant taste. I personally don't like Tylenol. I don't like Tylenol for any reason because most of the times it always hangs at my throat and always gives me this bitter taste. And another thing I hate amoxicillin because of the unpleasant taste. So from drugs like this, these are one of the disadvantages, but you just have to take them. Another thing is unable to use in unconscious patients. Can't administer an unconscious patient drugs per orally. How? Because the patients will need to swallow. And an unconscious patient that cannot obviously move his body reflexes to aid for swallowing cannot be able to take this. This is very unlike rectal administration. Rectal drug can be given to an unconscious patient because these drugs are mostly in suppositories form where the patient just has to stay in a same position where the nurse can easily arrange the patient in the same position and administer these drugs rectally. Another thing with rectal drugs is that they are usually used as laxatives. They are drugs that are given as laxatives to a patient to induce or to soften stool, whatever form of laxative. And lastly, is that it does not undergo first pass effect. Rectal drug administration, if you remember when we just spoke about first pass effect, is that rectal vein does not lead to the liver, it goes straight to the systemic circulation, straight to the heart, and then to the systemic circulation. So let's quickly talk about the topical route of drug administration. Topically means either, just think of it top, at the top. It's always at the surface. So topically, when we say topically, just think surface. It can be surface of anything, either surface of the skin or surface of membranous linings of the eye, the ear, and the nose. And I already described different ways topical drugs can be given. First of all, for dermatologic applications, we can see a patient with pruritus, rash, or whatsoever, and you ask the patient and you see that it was prescribed for a patient to apply this drug directly to the skin. It could be creams, it could be lotion. And an examples of drugs that are administered dermatologically is antibiotics. Meanwhile, some drugs can either be irrigated or instillated. So we call this form the irrigation or installation form. This is when the drug is given directly into a body cavity or an orifice. For example, vagina. Some drugs could be taken directly or if directly even through the urinary catheter. Some drugs are passed through these orifices so that it could treat some infections of the urinary wall. Some drugs can also be given by drops. That's for eye drops, we have ear drops, and also we have nasal drops. So all of this, an example of drug that can be given in this way, an anti-neoplastic drug can be given in this way. An anti-neoplastic drugs can actually be given during urinary catheterization, can be used to flush the urinary wall to prevent or to treat infections or cancerous tumors of the urinary wall. Well, inhalation, we already know what inhalation is, and most of us have seen some asthma patient under an attack, and we see how easily it will be to just get an inhaler for this patient. So examples of drug that can be given this way, corticosteroid drugs that helps to reduce inflammation can be given in this way. We have a lot of corticosteroid sprays and the like. But I wanted to talk about some drugs that are given slow release, though topically, and these drugs are usually given in a patch form. So they are going to be on that patch, and and it moves in a steady way. So it goes slowly. Instead of us jump starting with a priming dose or with maintenance doses, these drugs are just given in patches. For example, we have the nitroglycerin patch, which is used to treat coronary heart diseases. So this is another very important form of drug administration. So now we're going to be talking about the parenteral route of drug administration.